Hello, I'm Dr. Lim from KB Lim Skin Clinic. This is a short introduction to skin or cutaneous lasers. Laser is an acronym for light amplification by stimulated emission of radiation. Laser technology is based on Einstein's theory of stimulated emission of radiation. He theorized in 1917 that electrons could be stimulated to emit light of a particular wavelength. However, it took nearly 40 years before scientists were actually able to amplify these emissions, proving Einstein's theory correct. This has set lasers on the path to become one of the most useful and ubiquitous tools of today. Lasers are used in industry, in astronomy, in the military, for imaging purposes, in our homes, and in medicine and dermatology. The first true laser was a ruby laser constructed by Theodore Maiman, a physicist at Hughes Research Laboratories in California in 1960. Maiman used photographic flash lamps as the laser's pump source. This design, which is illustrated here, is used to this day. It consists of an optical cavity within which is the laser medium, a pump source around it, and a set of mirrors at either ends of it. The main components of the laser are the laser medium, also called amplifying medium, which contains the atoms to be excited to emit light. In addition, there's a pump system or pump source of energy that will excite the atoms in the laser medium using optical, electrical, or chemical means. And there's a set of mirrors which amplify light by bouncing them back and forth. One mirror is fully reflective, while the other is partially reflective. The partially reflective mirror allows a laser beam through. Laser media may be made of gas, liquid, solid. Gas include argon, carbon dioxide, helium neon, and so on. Liquids such as rhodamine dye. Solid lasers may be made of crystals or semiconductor diode. Crystals include alexandrite, erbium yak, yak, and ruby. Lasers work according to the following principles. Electrons in the atoms of the laser medium absorb energy from the pump source and become excited. The excited electrons move to a higher energy orbit, and when it returns to the lower state, the electrons emit energy in the form of photons. Certain characteristics make laser light unique. One is it is monochromatic. Mono means single. Chroma color, it is of a single color. It's very pure, it's of one wavelength. In the case of ordinary light, like from a flash lamp, it is polychromatic. Laser is coherent. That means it is in phase, in time, as well as in space. Flash lamp light is incoherent. Laser light is collimated, which means it travels parallel over distance. Flash lamp light, on the other hand, is divergent, and the energy falls as the beam diverges. So these characteristics make lasers very useful, and we use it in medicine, in cardiovascular surgery, in ophthalmology, in urology to blast kidney stones, for laser imaging, in dentistry, and of course, in dermatology. In dermatology, we use it to treat vascular birthmarks, spider veins, varicose veins, pigmented lesions such as freckles or lentigo, also known as age spots, and unwanted tattoo. It is also very useful for removing unwanted hair. Lasers can be used to rejuvenate the skin, to treat wrinkles, to treat acne scars, or it can be used as a minor surgical tool to destroy or ablate small lesions such as viral warts, benign skin growths such as age warts or seborrheic keratosis, and also some skin cancers. Lasers are used in other instances as well, like for the treatment of acne. We'll talk about that in a while. Treatment of striae, stretch marks, treatment of scars, hypertrophic scars, keloids, and treatment of psoriasis, and treatment of actinic or solar keratosis, which are precancerous skin lesions as well. Lasers work according to three modes of action: photothermal, photomechanical, and photochemical modes of action. We'll look at these. Here is an illustration of the photothermal mode of action. Essentially, light, laser beam, is absorbed by the target tissue, heat is generated, and heat damages the tissue. So that's how we destroy the tissue, using photothermal damage. Photo meaning light, thermal heat. Light induced heat damage. the other instance, the second mechanism is the photomechanical, is also called photoacoustic. The difference here is the very high energy beam of laser. It illuminates the target lesions, but only for a very short pulse duration. This is the on time. Just to give you an idea how short it is, 10 to the minus 9 is called a nanosecond. It is 1/1000th of a second. On the right of that, picosecond is actually 1/100000th of a second. You can imagine the very huge energy pulse over a short period of time. It causes a little thermal damage, but the most damage is caused by shock waves because of the rapid thermal expansion. Shock waves or acoustic waves are produced, and this is what destroys the target using shock waves. Photochemical mode of action. This uses a light-absorbing molecule, which is already sometimes present in the tissue. Like in the case of acne, I mentioned that briefly. It works because the acne bacteria, P. acnes, produces porphyrins, and porphyrins is a light-absorbing molecule. So we target the light and in the process kill the acne bacteria. So this is an instance of using light to kill bacteria. In other tissue, whether there's no light sensitizing medication or chemicals, we add the chemical to the tissue beforehand before illuminating it with a laser or some light beam. So this is called the photochemical, the use of chemicals for its action. There's one very important theory that we utilize always in the dermatologic use of lasers, and that is the theory of selective photothermolysis. Selectivity is the tool here because by selective photothermolysis, we achieve targeted destruction. We destroy the tissue, causing no or minimal damage to adjacent structures. And we can achieve this by matching the wavelength of the laser or the IPL machine to the absorption spectrum of the target tissue, and by matching the pulse duration on time of the laser to what's called the thermal relaxation time. So in this illustration, you can see the absorption spectrum of the three main chromophores in skin, which is melanin in black, oxyhemoglobin in blood, which is in red, and the water, which is in light blue. I draw your attention to the blue colored zone. In that zone, you can see that the absorption spectrum of melanin is much higher than oxyhemoglobin, blood, or even water. If you remember, water is present in living cells. So in this zone, we can use the lasers there to destroy melanin without causing much collateral damage. So this is the one theory, one concept of the theory of selective photothermolysis. The other concept is that of adjusting the pulse duration equal to the thermal relaxation time, or TRT for short. That is the time required for the heated tissue to cool halfway towards its initial temperature. And you'll notice that the thermal relaxation time varies according to the target. So in the case of hair reduction or hair removal, we're targeting the hair follicle, the growth area, and its TRT is 100 milliseconds. In the case of tattoo ink, it's 10 nanoseconds. So it's very important that we adjust the pulse duration to either equal to the TRT or a little bit less than the TRT of the target. This way, we can achieve selective destruction. Another important consideration is the depth of the target tissue. If we are treating tattoo dye, that is embedded deep in the dermis, or we're treating the hair bulb, which is also deeper in the dermis, you need the lasers that can penetrate deep enough, like those on the left. Those on the right will not have any lasting effect because it will merely destroy the superficial portions of the hair shaft or a bit of the tattoo dye, but not all of it. Okay, there are basically two broad groups of lasers, ablative and non-ablative. Ablative means it destroys layers of skin. Non-ablative means it goes through to reach its target without destroying intervening layers of skin. We'll look at ablative lasers next. The traditional laser is also called ablative laser. It's called an ablative resurfacing laser. It removes layers of skin. It can be pulsed, treating small areas using a small spot size, or it can be scanned to large areas of skin using a scanner which is circled. So the scan ablative resurfacing lasers can be used to treat the entire skin for the treatment of wrinkles and for patients with multiple acne scars. Now, the other modification of the traditional ablative resurfacing laser is what's called the ablative fractional lasers. What this laser does is, as opposed to the normal laser, which is shown on the left of this picture, the ablative laser breaks the laser beam into tiny beams, leaving healthy tissue which will serve as a source for healing. So ablative resurfacing laser, the normal traditional laser, will result in a considerable downtime and sometimes even complications. Ablative fractional lasers will speed up the recovery and also cause less complications. This is an ablative fractional laser. The difference is in the handpiece, which breaks down the laser beam into tiny beams. So again, it can be used to treat wrinkles, acne scars, but it's a lot safer than the traditional ablative resurfacing laser. Non-ablative lasers, as mentioned, do not remove layers of skin. It penetrates through, and lasers belonging to this group include pulse dye, diode, Nd:YAG, and alexandrite lasers. Again, these lasers can be used in the traditional form to treat the entire single beam with a large spot size, or we'll break it down into tiny beams as shown. So again, the principle is here to heat up layers of skin, not cause too much heating, which is damaging to the skin. The purpose of using heat is heat stimulates regeneration, and with degeneration, the skin improves. So we can use that to treat wrinkles and to treat acne scars. Non-ablative lasers do not remove layers of skin and do not cause any downtime at all, and it is also less painful. It doesn't require any anesthetic, unlike the ablative types where we usually either have to use a topical, apply anesthetic, or inject an anesthetic into the area. Finally, I would like to talk to you about intense pulse light, IPL machines. The intense pulse light is not a laser. It is polychromatic, many colors. It is incoherent, not in phase, both in time as well as in space, and it's non-collimated. It does diverge. The advantage of an IPL machine is it delivers a broad spectrum, so it can target many chromophores, light-absorbing molecules, different targets in the skin. And we make it more selective by using cutoff filters. So a cutoff filter of 515 nanometers would cut off everything above 515 and allow anything below 515 and below up to 420 nanometers through. IPL is also non-ablative, and it causes little or no downtime. Synonyms for IPL include broadband light, BBL, or sometimes the procedure is just referred to as a photofacial or a photo rejuvenation procedure. Here is an IPL machine with a monitor on the left where you set the energy, the pulse width, and temperature, and so on. On the right is the handpiece, and below that is a set of mirrors, cutoff filters that we use to cut off the wavelengths that we do not need. And therefore, we make the IPL machine a little bit more selective. However, it is not as selective as a laser, which you remember only produces one wavelength of light and nothing else. So I hope this provides you with a basic information about how lasers work, and it will help you understand the use of lasers for the treatment of other skin lesions. Thank you for watching, and please visit us at www.kblimskinclinic.com, where you'll find more videos and also educational material. Thank you for watching. I hope to see you again. Goodbye.